Quest did a recent health trend study that shows cancer diagnoses are still lagging, 11% behind pre-pandemic levels. So can you tell us a bit more about this new data and how it relates to delayed care?
So this study was actually done, Dr. Kaufman and I were talking about during the pandemic, what's happening. We had essentially the lockdown of society, and we put for good reasons, we put a lot of barriers up to getting into the healthcare settings, et cetera. So a lot of routine screenings, a lot of doctors' offices were, had protocols where they had to reduce the number of patients. It put a lot of barriers to getting screening done. What Dr. Kaufman and I talked about, what are the implications of that? And so we decided to look within Quest's databases, including Ameripath, which is our pathology division, to see whether or not cancer diagnoses were going down. And what we found, as you stated, was a significant drop in the number of newly diagnosed cancers in multiple disease types, including colorectal, lung, breast. The difficulty with that is those cancers didn't go away. We weren't diagnosing them. They're still there in the community. It's just that people were not coming in and getting diagnosed. The concern as an oncologist about that is that cancer continues to grow whether you diagnose it or not. And so the concern was that you're going to see more late stage. Early stage, we like to catch them early because there's much more of a chance of cure. Surgery, you take it out. There may not even be a need for chemotherapy. You just remove it and you're done. Later stage, you're either talking about, the inability for surgery to cure the patient, and chemotherapy has to be used, or maybe you have surgery, you require chemotherapy, and it's not a guarantee that you're cured. And so that's the paradigm shift that we were seeing.
And lastly, so how can the healthcare community encourage screenings and get back to care?
So again, we as a medical community, have been talking with our health system partners that we work with, et cetera, about how do you do this? And, we've updated that health trend study annually now for about 3 years, and we're still seeing that we're not back to baseline, even maybe close to baseline, but we never went above, which you would hope you'd, have a brief increase in the cancer diagnosis because of all those people who are missed. I haven't seen that yet. And so we've been working with our health system partners, our community partners, to basically take screening to where the patients are, take down the barriers to screening, whether that means working with community groups, doing, like a men's health day we've done where, underserved populations basically came in for screening for blood pressure, screening for, cholesterol, but we also did prostate cancer screening. We did colorectal screening. We basically told them the importance, found people who had early stage disease and then got them into the healthcare system quickly. But it's required us to think differently and basically bring healthcare to where the patient is.
Great, thank you. Dr. Fesko, that's all I had for you, but if there's anything you'd like to add, just on the study or of the topic of this, this gap of delayed care or...
The only thing I would add is just, we continue to be concerned about it, again, because we haven't seen that basically an increase in the cancer diagnosis to take us back to baseline, where you would expect all those patients who are missed to come in, you'd have a slight increase. We haven't seen that. And, as a country, we were doing better with cancer, as we know. The cancer death rate was going down, the survival was improving. And we're concerned that we may be taking a step backwards. You're not going to see it for at least 5 years because, the databases are only updated, like the SEER database, et cetera, are only updated every 5 years. That's why we kind of did the health trend study to sort of give us the first glimpse to see, is this happening in real time? And unfortunately, it's concerning. And I think it's going to require us as a medical community to all lean in together to solve this. Nobody can do it by themselves. I think navigation for cancer diagnosis is great in terms of getting the patients the biomarker, but ideally we don't want patients to ever get to the point that they need that because they're late stage. We want to catch it early when it's curable.